Thank you, Mr. O'Rourke. Mr. Coffman, you're recognized for 5 minutes.
Thank you, Mr. Chairman. First, I want to thank the Veterans Administration here today. This is the first. This is my second year on this committee, and I'm proud as an Army Marine Corps veteran. I'm proud to be on this committee. I'm proud of the members of this committee. It's the most bipartisan committee in the Congress. Republicans and Democrats standing shoulder to shoulder to make sure that our nation meets its obligations to those who serve this country in the military. And I feel that every hearing I've had prior to this, it's deny, cover up, and then delay giving any information to us. No accountability, no transparency on behalf of the Veterans Administration. And I got to tell you, I think there are a lot of great men and women who work for the Veterans Administration, and a lot of them are the whistleblowers who have put themselves at risk. That if not for them, we wouldn't be here today cleaning up this problem. And I just want to say that I think a third, if I understand it right, of the men and women that work in the Veterans Administration are in fact veterans themselves. And I would love if you would look at increasing that, whatever you can do to increase that number. I think that there's nobody that understands the needs of veterans more than those who've worn the uniform. And so whatever you can do to get that third up, I'd really appreciate it. So when we get to this 14-day wait period, and then I heard that its quote was simply not attainable, unquote. What is realistic?
I honestly don't know tonight. I do know what is unreasonable. I think 90 days is unreasonable. I think 60 days is unreasonable. I don't know what the right measure is. We have to study it. We have to look at what is right for an individual veteran is based on his or her own preferences. Acuity also needs to come into the mix. For cardiology, 14 days is not soon enough, right? It has to be based on an individual veteran's requirement. I think setting an across-the-board standard encourages an attempt to meet that standard. We'll still measure timeliness. We'll still aspire to be faster, but we won't tie rewards or incentives to that activity.
Didn't that benchmark, when you interjected financial rewards into that, fuel the incentive to manipulate these wait times?
I didn't I mean, in our surveys, we didn't ask people.
I mean, in your opinion, don't you think that it was a financial reward that incentivized this behavior, that the secret waiting list where veterans were ultimately denied care as a result of this manipulation?
Simple act of stating this is our goal, you shouldn't do anything other than this goal, even without a financial incentive, might drive that behavior.
Wouldn't they have spoken out, though? Wouldn't they be more inclined to speak out without the financial incentive that what's going on is wrong here?
We have to look at that second question. I think they're two separate questions, sir.
Okay. What is the... I just think it's going to be so hard. I think that this culture of bureaucratic incompetence and corruption is so deep, and I appreciate the forthright, I think, nature of your testimony today, but I think it is so deep and so ingrained in this organization that it's going to be very hard to turn around. And what I hope occurs from this is that veterans have a choice, that veterans have an option, that if you're not able to meet their health care needs, that they can go outside the system. And I hope that then incentivizes the Veterans Administration to see them as customers, to see them as their patients. And right now, I don't think that's, I think there's great variances between facilities, as you mentioned, I think across this country. But I think that there has to be an incentive for them to see them as their patients, for it to drive some quality standards, for them to care.
If our veterans are happy and more of them choose to come to us, we're having a good year. If we can deliver safe, quality health care that is timely, we'll get there.
And if you're not, they ought to be allowed to go outside the system, reimbursed by the VA. And I think, as you mentioned, Dr. Draper, the management structure really isn't there to support that, and I think it needs to be developed to support that. With that, Mr. Chairman, I yield back.
Thank you, Mr. Coffman. Mr. Walsh, you're recognized for 5 minutes.
Many decades of good work can be erased very quickly by bad actors, and the question is where do we go from there?